So I'm really, really excited today. I'm in Salinas. I'm at the Health and Wellness Center in Salinas, the UnitedAg's Health and Wellness Center. And the reason I'm excited is a couple months ago, I was here for a meeting and I happened to meet Stan. And we just had a conversation and he talked about why he works here and what he does here as a PA at the Health and Wellness Center at UnitedAg. So I just said, I'm going to come back here, Stan, and we're going to have this conversation. So I'm excited to have you as a guest on This is Ag.
Yeah, thank you for having me.
So now that I kind of said what you do, so can you elaborate a little bit on that?
Yeah, so I'm the PA here at the UnitedAg Health and Wellness Center. So basically, I help take care of all of the UnitedAg members. So they'll come in for whatever issue, and for the more common things, I'll just take care of it. And for the more complex things, I'll refer them out to specialists. I'm pretty much their primary care.
Yeah, so Stan, why this profession? What made you decide to become a PA?
I think a lot of people are drawn to the healthcare profession because a lot of people just have a strong desire to help. And that was my desire too. And I think that I'm really lucky to be able to. I think this job is, I really appreciate that it's so, like I'm helping people directly face to face, and not a lot of people can say that about their job. So I think that's what I was attracted to. And this job specifically, I think kind of played to my strengths. I live in this area. It's kind of a more like semi-rural area. And they were looking for someone who spoke Spanish and who had some experience in this area. So it just kind of seemed to jump out to me.
Yeah, this is primarily, like you said, we serve agriculture, right? So it is all our members coming in here are from that industry. So very different when you really think about it. So what has been your experience working with our members? Is that a different experience than outside?
Totally different, surprisingly, actually. Yeah, I've worked in a couple other jobs in healthcare. And yeah, there's a few things that did surprise me about this. Specifically, well, I really like the population I work with. They tend to be like kind of very humble, hardworking people. And I do really like enjoy them. And I think they're a particularly worthy group because they're so hardworking and just because, you know, what they do is so important. So
they're feeding the nation or the world, I guess.
Yeah.
Right?
Yeah. So I like them a lot. That's one difference.
Yeah.
And also it's really profoundly different in a lot of ways. And for example, it's the first place I've worked where we actually have time for the patients.
Yeah.
And we really seem to be oriented towards just simply taking care of them rather than, you know, fulfilling any kind of quota or any metric or anything like that. Really, it seems the goal is just to do whatever we can to help them succeed. And so, like, for example, in this clinic, we take, you know, special time to like help them navigate their insurance and to kind of just help them navigate healthcare in general, because a lot are Spanish speakers. And I think I was surprised how hard it could be for a lot of them to interact with the insurance industry. And so, yeah, we actually have the time to actually help them like navigate a little more. And yeah, I was really kind of impressed and blown away by that.
You know, that was set up intentionally, right? Because when you make that point, that's so important, because when you have a clinic and you're looking at the metrics and you're saying 15 minutes per patient, and then you move on, how many patients did you see and what does that look like? Our approach is very, very different, because have you taken care of the member, right? That's more important than how much time have you spent with that member, right? And that's a very different thing. So it's interesting from your side as a provider, you appreciate that too, because as a patient, definitely yes, and as a member, yes.
Yeah, because I feel like deep down, everyone just wants to help, and so that's why I enjoy it so much. I think it's a good job for that reason. And unfortunately, a lot of people in healthcare don't really get to help to the extent they want, because they're in these like bureaucratic kind of machines that restrict them And I think that contributes a lot to
Right.
burnout, is they're not allowed to help people when they, to the extent they'd like to.
Right. That's really true. I mean, the burnout can happen because you overwork, but burnout can also happen when you're not doing what you truly want to do, that you want to help that patient with the restrictions of everything around you, like this, and the bureaucracy, which is driven by numbers game, right?
Mm-hmm.
Is that end? It's a numbers game, and we don't play that game here.
Mm-hmm.
Yeah.
Yeah, it's something that I realized right away. I realized that it was a totally different system right away because it felt so different. And I realized pretty quickly that it all comes down to, because it's a subscription-based service, it's like it's part of their members' fees as opposed to like a fee-for-service kind of thing like they have at other,
Right.
at all other clinics pretty
Right.
much.
Right. And that makes just that slight change and looking at things changes stuff. So when you are taking care of a member,
Mm-hmm.
and I've heard so many stories about you and feedback from our members and our service reps, you go beyond, way beyond what is required of you in your position. And I've heard so many good things about that, right? So where does that come from? Is this like, I know you said you want to help people.
Mm-hmm.
A lot of people say they want to help people, but there's something else deeper in you that you go way beyond. Why is that?
Well, thank you for that feedback. First of all, that's good to hear. And yeah, what makes me go a little deeper? I think it's probably complicated. It's probably my personality to some extent, but I think a desire to do the best I can for people and just to kind of make people feel like happy and safe and satisfied. Partly maybe just because that's how I am, but also because it is important, I think. Like, I do think it's important to take care of people in your life and to serve others the best you can. Like, kind of treat people how you would treat your family, that kind of thing.
Correct. And that's important, right? I mean, and you're building a relationship. And the thing that's different at our health and wellness centers as opposed to others is once they get to know you, they trust you, right? And then they want to keep coming back to you.
Mm-hmm.
And more so in Salinas and the industry we serve, I feel that plays a really important role, right? The trust and the relationship. Do you see that when you see patients coming in and just being comfortable with you and having that trust with you, they receive that information from you differently?
I think a couple things. Yeah, I think the Spanish makes a big difference. I think there's so many Spanish speakers are so used to just getting nothing, like having no support and really just kind of getting like the short end of the stick
Mm-hmm.
a lot of times, and like not really getting as good a care. And so I do think they appreciate that. And I do get some thank yous because they can see that I try my best to speak in Spanish with them. And then also the relationship aspect, where I do notice how the longer that I know them, the longer that I see them, the more comfortable
The trust level
and
goes up.
easily
Yeah.
they come in. And I think that's a huge thing, because I think trust is a limited commodity in healthcare, especially for, people from other countries or other cultures, where people simply just won't go to the doctor because they don't really know who to trust, or maybe they're afraid they're going to be told what to do or given some treatment that they don't understand or that they don't believe in. But I think that aspect that you mentioned, it does kind of overcome that barrier a lot, where basically if someone who they trust is telling them or, recommending that they take a medication, that they're more likely to actually do it,
Yeah. Do you find that in typical, when medications and stuff, the adherence rate or whatever is not that great? Do you find that more in ours because of how you do it?
The adherence rate in general is abysmal, like in this country and
Right.
probably just in all countries is just terrible. It's like, I can't remember any specific numbers, but it's probably the minority of patients who take the medicine as prescribed. And in this setting, I'm actually often surprised and impressed by the initiative that people take to take care of their health. I think by coming in here, they've already started to make a commitment. And then once I see them repeatedly, it starts to become natural to them to follow through on the treatments. I suspect that a lot of the UnitedAg members, agricultural workers just never come in here to begin with. Maybe because they're younger males and they feel they don't need to come in, or maybe because they just have no interest in interacting with that.
So
with
what would
healthcare.
you say to somebody who's listening in who falls into that? Why would you recommend them to come and see you?
Well, probably because it's just not as scary as they might imagine. And, I try to make a point to really kind of like respect people's autonomy a lot, where I'm not going to, pressure any kind of treatment. I'd say the biggest reason to come in is just to be informed about what the recommendations are for you and your particular situation. And whether you choose to follow a recommendation or not is really just a personal choice. And so, yeah, just come in and listen to some recommendations about what tests or medicines are recommended. And then you can make the choice later. And I'm not going to make you feel bad for not, following the recommendation, but gather as much information you can and listen to as many angles as you can, especially because the mainstream medicine angle, it can be really
confusing or skewed.
Yeah, it can be confusing, but oftentimes it can provide like really simple and really effective treatments. And it could prevent all sorts of like medical problems down the line with very small.
That's a good point, right? So because if they come into the clinic and you take care of them or give them that path, that will later ER visits and hospitalization and impact that has on that is lessened.
Absolutely.
Right? Forget the cost for a health insurance company or forget the cost for the overall healthcare, but just for our well-being, right? That something to take care of. It's like going to gym or taking basic care of ourselves.
Mm-hmm. Yeah. And just an example to kind of illustrate that point is when I was in school, like doing the clinical rotations, you see a lot of the end stage. You see a lot of like what happens if a condition goes untreated for decades and it's really too late at that point. Like when you're in the hospital, like I would see a lot of patients that were like in and out of the hospital for the end stages of diabetes, and it was costing the system, hundreds and hundreds of thousands of dollars, and their health was in such poor condition. It's a lot easier to intervene much earlier. Yeah.
Great. So what's a common thing that you see here? What do people come here for?
The most common things that we treat are like cholesterol, diabetes, high blood pressure. And those are the most common conditions in all of the country. Especially the Hispanic population is a little more predisposed to like diabetes genetically and probably with lifestyle too.
Right.
But, anyone who eats like a Western diet is really predisposed to those things too. But yeah, diabetes, high blood pressure, and those are good examples of things that are very simple to treat and will change your life, like fundamentally, if you choose to treat them.
Right, yeah. So if somebody were coming in and the fact maybe I don't know my A1C is high, so coming in here, testing that out, what kind of support do you offer after that? Is there?
Yeah,
I could just freak out and leave.
No, yeah, that's a super common thing. Some people are just concerned about their health. Maybe they have a health problem that runs in their family. Sometimes people come in after doing these work screenings that we host. And, usually I'll just kind of go through the evaluation, ask them if they're having any symptoms, do a physical exam if it's indicated, and then order the appropriate labs. We'll go over those lab results and talk about, interventions at that time, if there's medication, if it's just lifestyle changes, and just go from there.
And do you offer yourself as a resource then if questions and stuff come up? Because I know we do the virtual help too. Do that call come to you or that goes across, right?
Yeah, we do a lot of phone calls. So yeah, I tell everyone, call us at any time. And if any questions come up or if you have any issues at the pharmacy or anywhere. So yeah, we definitely offer ourselves for resources at that time. And just in a medical sense too, if you ever want to talk more about your diet or any aspect of your health, then we're always available. And if they need a little bit more help, sometimes we refer them to the nutritionist and so on.
Yeah, because what we, even from the member services team at UnitedAg, what we find, right, what you said earlier, distrust, and they could also be a little bit anxiety involved because it's a very culturally, I mean, from a culture standpoint, from other things to come in, right? And that causes anxiety in that. So this puts them, once you come in, this puts them at ease, and so they talk to somebody like you. So I hope more people come here and build that relationship.
Yeah, I hope so too. I think there's probably a lot more potential of members that could come in more, right? I'd imagine.
Right. And we do the biometric screening, the flu shots and stuff like that. So when you're looking at, let's say, a week, right? And or reflecting back on a week or month, what do you think what if a day is your favorite day? Why does a day become a fulfilling or your favorite day? What needs to happen?
I think there's a lot of fulfilling aspects. I think, well, obviously when you like maybe catch something serious and you clearly see that you've benefited somebody in a material way, that can be fulfilling. And something that also jumps out to me on a regular basis is sometimes just, even if you're able to do something small for someone who would otherwise not have done it, that can really affect me too. A lot of these patients are like very kind of humble, and they don't often interact with healthcare. So when they finally do, and you're even able to give one simple treatment, you've made a big difference in their lives.
True. That's true. I tell this story about one fish at a time. And it seems like that. If you've helped one person, right? It's like when you talk about the big issues, and you said if you've had an impact, anything that you can recollect, any stories where you've had an impact like that?
Well, sometimes from time to time, it's just someone comes in with an obvious problem. Like, just last week, a lady wasn't able to move her arm. She came in for like lab work, like to review her diabetes blood work. And she mentioned, and my arm isn't bothering me. I looked at it and she wasn't able to move it even a little bit. And so she probably had like a tear in her shoulder. And so kind of making sure she started getting that treated sooner was really important for her. And then, there's another time that kind of stands out to me a little bit. I've had a patient say to me once that I asked her if she wanted more workup for a problem that she had brought up. And I said, well, are you interested in doing more workup? And she said, only if it's free. If there's any cost, I'm not interested. And to me, that kind of frustrated me a little bit to hear that. But at the same time, I kind of reflected and I realized the fact that she's in here and able to get access to these, basic treatments would have never happened if we had a different model, like where if she had to make a copay, for example, there's no way that she would have gotten any help. So,
right. Because for some of our employees and some of our members, even that $5 or $10 is something out, right? First of all, you are leaving work. You're losing income, right? And then you come in here, you make a really, really good point. The fact that we offer it at zero copay to a membership, at least we're crossing that one hurdle for them to come in and take care of themselves. That's a good point. Yeah. How do you get people past that? Saying that's a hard one.
It's tough. Yeah. I think it's just continued effort like we're doing, just trying to advocate and communicate more with them. And hopefully with trust, even those barriers, they'll realize, because I'm sure that if she understood how important it was to get it worked up, that she would consider, but you just have to keep having that relationship and those conversations.
Right, because there's so much mistrust because of, like we said earlier, right? It's a numbers game outside. So like you're trusting, here is UnitedAg, a health insurance company, in their health and wellness center. Are they doing this to reduce cost? Is this really for my benefit or is this for their benefit, right? And you start questioning that and then the trust erodes. So that could happen.
And it doesn't take much, I think, to gain trust in this environment. I don't know if it's unfortunate that it's this way, but even just a little bit more help, if you give them just a little more help than they're used to, it really, I think, surprises them and can them at ease.
Agreed. And the sad part of this is, right, when we're reflecting on how it happens and how it happens here, the difference between that, every time I hear the feedback about you, I'm sure you might not remember that as a big thing because maybe you just spent 5 minutes more or 10 minutes more with this person, but that causes an impression on the other person because anywhere else you're rushed. You're like, oh, my 15 minutes is up. I'm going to see the next patient. I'm move on, right? Mm-hmm. Just the fact that even you sit down and listen to them, I'm sure that's like, this is a provider who's listening to me. This is different, right? And that's when I'm like, oh, this is amazing. Even if you don't help them, you listen to them. That's enough sometimes.
It's enough, yeah. Or just extending a little bit more kindness to them too than they're used to. Those are the things that the patients really care about. And in my opinion, what I've seen is they don't really care about even the numbers, the A1C numbers, the blood pressure. They don't care about any of that as much as just the human aspect.
That is so true. That is so true. Do you find that is more true with us in our membership, or is that across the board as you've seen that in other roles that you've served?
I think that it's across the board. And even in school, they teach us like the easiest way to avoid being sued is to be liked by the patient, which is a statistical fact.
Yeah.
But so I think across the board, that's what people really desire is like a human interaction. But the difference is that in this environment, you can actually fulfill that desire. Whereas in other environments, that I've been in, for example, like the urgent care, there is very little human interaction. It's really just like bottom line kind of stuff, like trying to see as many patients as possible.
What would make it 1% more better for you? Because we're always asking this question at work. Mm-hmm. It's like anything that you do, how can you make it 1% better, right? So what makes here doing what you do 1% better?
That's a good question. I guess probably seeing more patients.
Seeing more patients, yeah. Having more of an impact. Yeah,
that would be better.
Seeing more patients, getting this word across to more people, maybe utilization increasing. Wonder how we can do that, right? How can we do that 1% better, where we get this word out to more people so they can come and experience what we have here?
Yeah, helping more people. Yeah, that would be the thing. But not at the expense of, all of the good things that we have going on here now. And I don't think it's just seeing more patients per day, but just if there's any way to help people more, I think that would make it make it more rewarding. So yeah, how to do that is a good question. Honestly, I think continuing to have kind of conversations about this topic, I think it's the intangible things that could be the most effective, like actually showing appreciation, me showing appreciation for the patients and just having that human connection and kind of the patients having a good experience when they come here, as you just said. I think organically it has a way of spreading. That could be the most effective way that I could imagine. And also the thing that our whole country is missing, when it comes to healthcare, which is just the compassion and appreciation and
putting humans first, right? I keep saying that we've forgotten that we're treating human beings here. Let's put the human beings at the center of everything that we do, right? So part of why I get passionate if somebody says, what brings you joy at what you do at UnitedAg? It's exactly what you said. I'm looking at it from a bigger health plan picture. There are certain things that people say, this is how it should be done. Member services, this is how many minutes they need to spend time. This is how a renewal happens. This is how pricing happens. This is what you have to do from a healthcare standpoint. I'm like, why? Why is that? Right? Why can't we challenge that? Why can't we do something different and show that it has an impact from a financial standpoint, from a growth standpoint? UnitedAg has tripled in size, right? We did right by the people. We put human beings at the center of everything. We said we're not going to be driven by metrics, not by the bottom line, but just taking care of people, right? And that's the same thing you said. So being in your role, what you do, you walked in here and you were pleasantly surprised that's different here. So by doing that small thing, hopefully we're causing a dent in the entire conversation around healthcare, that it can be done, right? If you're a provider, you want to spend more time with your patients and the patient needs it, why not? That should make business sense too in the end.
Yeah. Yeah, no, just because everyone does it doesn't mean that it's the right way to do it. Personally, and I think a lot of people in healthcare might feel this way, it's not a sustainable system. It's not a system that's going to survive this way for very long, I don't think. And so I would say if the mainstream insurance kind of perspective is to do something a certain way, I would say that definitely does not mean it's the right way to do it, because our healthcare system is not in great shape, I would say, right now as a country.
Agreed. So if you and I can cause a little bit of that change in the conversation around healthcare and what needs to happen, what a great thing that would be, right? So that's what we're trying to do through UnitedAg. Anything else, Stan, that I missed?
I think because everyone wants to be helpful and everyone wants to have a positive impact on the world deep down, even if you're distracted by other things like, oh, I am saving up money for this or that, or even if you have many other things going on in your life, I think that is what everyone really wants, is to just to help people.
That's a great way to end it. That's what everybody really wants, to help people. That's so true. So true. So anything from your experience, Stan, anything a listener can use that as a takeaway. So let's say I'm listening to this and you are on the call. Can you tell me a few things that I can do differently? And anything that you've learned from your experience?
I think most important thing is to simply take care of yourself. I think a lot of people are caught up with taking care of the people in their lives, taking care of your kids or whoever in your lives, and you don't have time to think about yourself. And I think if you simply extend that care to yourself, it can go a long way. Go see your doctor for a regular checkup and just do those basic things to take care of yourself, just the same as you would take care of anybody you loved. And specifically, I would say the most important thing you can do to take care of yourself would be to change, for Westerners, would be to change their diets. So that's really what's causing people's lives to be shortened, is their diets. So just, do whatever you can to change your diet. And there's lots of different, good diets, but just you can do a lot for yourself with diet, lifestyle, exercise, just a healthy, balanced diet. In our society, these hyper palatable foods, these really yummy foods, and calorie dense foods they're addictive. People are making a lot of money off of it, but just keep trying to go away from that and adopt as balanced of a diet as you can.
So if somebody were to looking for more information on that, when you say have a balanced diet and somebody might not understand what that means, where would they go to? Any recommendations?
Well, I think a lot of it is, when it comes to diet, people make it a lot more complicated than it needs to be. You just want to have less processed foods, more fruits, vegetables, less meat, less carbs. There's a lot of good options for diets. The Mediterranean diet, vegetarian diet. There's many different options, but you can really keep it simple. I think everyone really knows what a good diet is, at least in a general sense. But if you want more information, well, for all of our members, you can reach out to us. Yeah. Cool. And then, or their personal doctor.
Yeah. That's a good point, right? So sometimes we overcomplicate everything, right? You overcomplicate exercise, you overcomplicate eating, and just go for a walk, right?
Yeah.
I mean, the basic stuff. So you're saying just take care of ourselves first, take time for yourself, do your basics. You don't have to overcomplicate anything. Eat the right food, do the right exercise, like basic exercise, and you'll be okay.
You'll be a lot better off.
Yeah. The consistency behind it, right? So that's such a good point. It's a, when you say take care of yourself first before you take care of others, I say this in my UnitedAg Academy a lot, because as moms and you are in that giving phase, right? You take care of others first. But I always say, put on your mask. I mean, every time we get reminded when we are on a flight, right? Put on your mask first before you put on your mask, anybody else's mask. So that's what we all need to remember. That's the first step.
Yeah, it is.
So Stan, anything else? What do you want to say?
Just if you have any questions, come in and talk to us. Don't hesitate.
Okay. And we are on the website. You can go in our health and wellness centers. You can make appointments. So you can come here to the health and wellness center in Salinas and take up on that offer, because anybody I've talked to, Stan, that they really, really have that connection with you and you've built a strong relationship. So hopefully people will come here. Thank you. Okay.
Hopefully.
Thanks.
Thank you.